Hello doctors, this is Dr. Ilma. Today I'll be discussing some commonly asked questions from genetics in your UKMLA Part A exam. So let's get started. The first thing we're going to solve today is pedigrees. To solve pedigrees, the first thing you need to know is differentiate between an autosomal condition and an X-linked condition. To do that, the first clue is to look for whether there is any male-to-male transmission or not. If you see that even a single generation in the pedigree has male-to-male transmission, then this is an autosomal condition. On the contrary, if not a single generation has male-to-male transmission, then it is an X-linked condition. So now that you have differentiated between an autosomal and X-linked condition, you proceed to determine whether it's an dominant condition or an recessive one. To do that, you need your second clue, which is to see for generation skip, by which it means to look for the carriers. If at no point of the pedigree, like no generation has any carrier state, or there is no generation skip at any part of the pedigree, then they are the dominant ones. But if even a single generation has carrier state, or there is generation skip even at single point of the pedigree, this is a recessive condition. So to summarize the solving of pedigree, the first clue you need to know is whether there is a male-to-male transmission or not. Even if a single generation or more has male-to-male transmission, this has to be an autosomal condition. And even if no step of the pedigree shows no male-to-male transmission, this is X-linked condition. Then you look for the carrier states or the generation skip. If no generation skip at any point of pedigree, this is dominant. If there is generation skip or carrier state even at single generation, this is recessive. Okay, so this is how the pedigrees look like. You will be given some square boxes like these and some circular boxes. By the square box they refer to the male, and by the circular ones they refer to the female. Then if they are completely filled with colors like these ones, then they are referring to the affected ones. If they are empty like these ones, they are unaffected ones. And sometimes they fill it like a half of it, or fill it like these diagonal lines, they will refer to the carrier state. But most of the pedigrees nowadays given in the exam do not have any separate half filled or diagonal lines in carrier state. They're also given like the unaffected ones, like the empty boxes, and then you have to look for other clues to ensure whether it's a unaffected one or carrier ones. You will see what I'm trying to say. Okay, so in this pedigree, if we want to solve this one, the first clue was what? To look for the male-to-male transmission. Is there even a single male-to-male transmission? Yes, there is one in here and there is another one in here. Even a single one was enough, but we have male-to-male transmission in 2 generations. Alright, so the first clue here is done. Male-to-male transmission is present, so it's an autosomal condition. Now let's look at your second clue. Is there a generation skip? No, there's no generation skip. Like this guy here is affected, and this one, I'm assuming this is a healthy one. So they had these 2 children, and he transmitted his disease to this boy. Then he married and had his own children, where he also transmitted his disease to his boy. Okay, so there is no generation skip in this way. However, some might think that there is a generation skip here, or they are maybe carriers, but no, just look that they had a daughter from the affected family, from the affected father. Yes, if it was given up to this, it might have been confusing whether she is a carrier or a healthy one. But since her daughter or son doesn't have the disease, so we can safely assume, safely say that this generation from here and onward will be completely unaffected from this condition. So they are healthy. This is not generation skip, this is not a carrier state, they are healthy. So there is no generation skip in this pedigree, so this is a dominant condition, which means there is no carrier state. Let's look at another pedigree here. Look at your first clue. Is there a male to male transmission? Yes, there is one. So this is autosomal. Is there generation skip? Oh yes, there is generation skip. There is generation skip in here. There is generation skip or carrier in here. Okay, now this guy is the affected one. Now had children where he transmitted his disease to his boy, and the girl here, mm, up to this you are not sure whether she is unaffected or she is a carrier. But when you are given that she had children where her daughter is also affected, now it's sure that this woman here is most certainly a carrier. That is why she was able to transmit the disease to her daughter that her father had. Okay, that's how the recessive condition works like. That's what genetics works like. Okay, so there is a generation skip and there is a carrier. So this is a recessive condition where there are carrier states. Okay, another pedigree here. Look at your first clue. Is there a male to male transmission? No, one male is affected, true, but it's from his mother, not from the father, and also he didn't transmit anything here. So no male to male transmission. So your first clue here is no male to male transmission, so this is an X-linked condition. Moving on to your second clue, is there a generation skip or carrier? Yes, there is. Similarly, like the last one, there is one here, there is a carrier state in here, this lady is here a carrier. So the X-linked recessive condition where there are carriers. Actually this is wrong. This should not have been affected. This guy should be affected, because in X-linked recessive conditions females are always carriers and males are always affected. Males are never carrier and females are never affected. This is something you need to know, uh, which will help you to solve the questions. Okay, now look at one actual question that came back in May 2023. So as I have been telling you, read the last question first. Here is your last question. What is the mode of inheritance? Okay, so in your exam paper, you are solving multiple questions. You are not sure which system you are going to face next. So when you are reading the last line, you will know at least that, okay, this is a question from genetics. Like it is asking the mode of inheritance, very obvious, from genetics. So now your mind is circling around the things you have read in genetics, what you know about genetics. So you look uh, above the question. Always go one line behind, one line behind. That's how you solve the question. Okay, so above the question there is a pedigree. You start solving it, because it is already very clear that the question is asking the mode of inheritance based on this chart here. There is no need for you to read these irrelevant, unnecessary informations from the stem. A waste of time. You don't need it. You just need to solve this pedigree here. Okay, so let us solve the pedigree. Your first clue, is there a male to male transmission, even a single generation, like a single step? Yes, there is one, there is two actually. So your first clue is done. This is an autosomal condition. Now go to look for your second clue. Is there a generation skip at any point? No. This guy transmitted the disease here and this guy transmitted to his boy. Since this lady is free of disease or maybe a carrier, but no other information is given here, so it's you can just assume that this girl is fully healthy, and so will be her next generations. So this is not generation skip, they're actually healthy, good, completely fit people. So what is the answer to your question? This is an autosomal dominant condition. First you saw that there male to male transmission, so autosomal, no generation skip, so dominant. This is autosomal dominant. Very easy. Pedigree solving is very easy and it takes you at maximum 15 to 20 seconds from reading the question, solving it, and marking it on your exam paper. If you approach these questions in this pattern, like I told you. Okay, so pedigrees are very easy. If you get a question from pedigree, you are very lucky. Okay, so we are going to proceed to our second topic for today, which is to solve the questions like what are the chances of the child being affected, what are the chances of the child being healthy or being carrier. I know that most of the candidates, even me at first, found these questions very nerve-wracking, very confusing, but actually they're very easy to solve. You just need to know how to read the questions and how to interpret them. Okay, so to solve that sort of questions, you need to memorize two things. The first thing is to know the examples. The examples I have written here in these two slides is more than enough to pass in UKMLA Part 1 exam, not for the other exams like in medicine related papers. They have many more examples of autosomal dominant, X-linked dominant, much more critical, but these two slides and these examples are more than enough for you to know in your UKMLA Part A exam. So you just have to memorize these two slides. Okay, after you have memorized these two slides, you proceed and solve different scenarios like this way. Okay, you have to know how to do this calculation. It is better to make a note on by your all by yourself, like write down in a paper what will happen in an autosomal recessive condition where both parents are affected, where both parents are carrier, where a single parent is a carrier but the another is healthy or the another is affected. Like this way, what will happen to the children, what is the percent of the children being affected, what are the chances of the children being healthy or a carrier. I have shown you some of the conditions, but not all of it. So you can go ahead and make your own notes. Okay. The first one I'm going to show you is what will happen in an autosomal dominant condition where one single parent is affected and the another one is healthy. So let's assume that they will have 4 kids. It's not like they will have 4 kids. It's always assumed in 4 kids to divide the portions, like each representing 25%, altogether 100%. It is to ease your solving the question. That's why. Okay. So there can be 4 possible outcomes, 1, 2, 3, and 4, uh, or 25% for each. So the first result here, this one, since it's a dominant condition, a single gene mutation is enough to cause the disease. This one here is affected. This one here is healthy. This one also healthy. This one again affected. So we can say that 2 out of 4 or 50% are what? Affected. Similarly, 2 out of 4 or 50% is healthy. So if you write it down, this is how it would look like in an autosomal dominant condition where one parent is affected, 50% of their children will be affected and 50% completely healthy. Now remember that in your UKMLA Part A exam, only and only in autosomal dominant condition, they will ask you what about the grandchildren. Okay, like what will happen if these two people, the affected ones, have children. Okay, so if this guy here, affected one, has children, they will also have the possibility of having 50% affected and 50% healthy. Also this one, 50% affected and 50% healthy. But this 50% is related to who? This 50% is related to this one, right? Not to this guy. This here is the third generation and this here is the first generation. So when they're asking you what about the grandchildren, they're actually asking you the relationship of the first generation and third generation. So the relationship of the third generation to first generation is or this 50% to this guy here is 50% among these 50%, like these 50% of grandchildren will be affected, which means what? 50% equals to half, which means half of 50, so 25%. So whenever in autosomal dominant condition they are asking you how many of the grandchildren has the chance to be affected, you have to read the question very carefully. Are they asking you about affected? Then it would be 25%. What if they had asked you about how many of the grandchildren will be healthy? It will be the remaining ones. So 100 minus the 25 equals to 75. 75 will be what? Healthy. And 25 will be affected. Okay, let's solve a question like here. Read the last line. What are the chances that his grandchildren being affected? Okay, so you saw a grandchildren being affected. You also looking at the options, so you're pretty sure this question is from genetics. And like I said, in genetics, whenever they're asking you what will happen to the grandchildren, how many of the grandchildren will be affected, there's definitely, most certainly, a autosomal dominant condition somewhere in this stem here. If you look carefully, you will find one like here, Huntington disease. What is Huntington disease? It is an autosomal dominant condition. So in autosomal dominant condition, what are the chances of the grandchildren being affected? 25%. Very easy. Now, similar stem, but the question is different. And this is also from Recall, February 2021. What are the chances that his grandson would be a carrier? Again, when you saw this is grandson and the question is from genetics, you look for the autosomal dominant condition somewhere in the stem in here. Is there any autosomal dominant condition? Just to be sure, yes, there is. Huntington disease and autosomal dominant condition. Now, what do we know about the dominant condition? We know that in dominant conditions, there can be no generation skip. There can be no carrier. There is no carrier. So the chances of the grandson in a case of an autosomal dominant condition of being carrier is 0. Like the grandfather is affected with a dominant condition, so the chances of any of his generation, not just the grandchildren, actually any of his condition of being carrier is not a chance. It's a 0% chance. Dominant conditions do not have carriers. So you need to read your question very carefully. Is it asking you about the carrier? Is it asking you about how many are being affected, or asking you how many will be healthy? Okay, okay, let's see another question. Okay, read the last line. What is the mode of inheritance? Okay, a genetic question. Look at the pedigree given above. Okay, we are seeing that there are two empty boxes, so maybe one of them is a carrier or both of them are carrier. Now look at the outcome. The first child here is affected. Okay, definitely at least one or both of them will be carrier. So I need more information. I go one line above from here. From the diagram below, which option best describes the chance of the unborn offspring represented by the arrow here having Duchenne muscular dystrophy if the child was a male? Okay, I have already gotten some clues here. Like the first one is Duchenne muscular dystrophy or DMD, and another is they're asking you about the male, if the child is male, since it's unborn, so they have given you the gender. It's a male child with DMD. Now if you have memorized the examples given in the two slides I had shown you before, you will know that DMD is an X-linked recessive disorder. In X-linked recessive disorders, the females are always carrier and the father, the male, he is always affected. So we need to calculate. We can assume from the pedigree we have already, like maybe one was affected one was carrier or maybe both were carriers. But since it's an X-linked recessive disorder, only the mother here, the female one, can be carrier. So what will happen in an X-linked recessive disorder where the mother is carrier and the father is healthy? This is the result. The first one here, as you can see, is the girl who is a carrier. Second girl, healthy. The first boy here, healthy. The second boy here is affected. How? Although has a single gene mutation, we know that in recessive conditions you need to have double mutated genes to be affected. But since it's an X-linked disease, right, so the X gene needs to be affected. Like in this case, if both had affected genes, both X's were affected, then she would be affected too. But in case of male, since the male already has only single X gene, so that single X gene is already affected, so the male guy is affected as well, because that was the only viable X he had, and that is affected, so is he is affected. Okay, so if a stem like this is given in about the X-linked recessive disorder where the mother is the carrier, which the mother will always be the carrier in recessive condition, and the father is healthy, and the gender is mentioned, like how many what will happen to the boy or what will happen to the girl, so then it will look like this. A carrier mother with healthy father will have 50% of her son affected, 50% of the girl affected. Okay, 50% of the boy and 50% of the girl. Like they're trying to say that out of four, if two are girl and two are boys, so one of them being carrier means 50% of the girl being carrier, not actually healthy, it should be carrier, and 50% of the boys will be affected. Okay, what happens when the gender is not mentioned? Like they didn't tell you, or you don't know how many boys or girls are there, they are asking you the result in all together. So in that case you will consider again four possible outcomes, each having 25% of chances. So you can see that two here are unharmed, like they do not have the disease, and they are also not carriers. So 50% or 2 out of 4, they're completely healthy. 1 or 25% or 1 out of 4, they're carrier, this one, and remaining 25% is affected. Okay, so whenever you have a question from X-linked recessive disorder and the gender is mentioned, you answer it from here. But if the gender is not mentioned, you have to answer it from here. So the question we had, the mode of inheritance where the carrier mother with a healthy father and having DMD, and if the unborn child is male, so the gender is mentioned, the male, what are the chances of him being affected? 50%. That is your answer, 50% or 2 out of 4. Okay. Okay. Now, this is the last question for today, the most difficult and confusing one, but a very good question. Let's solve this one. Okay. What is the likelihood of Zoe being carrier for cystic fibrosis? This is the last line of your question. So what are the clues you are getting? They're asking you about carrier. They're asking you about cystic fibrosis, which is what? An autosomal recessive disorder. Okay, but to determine whether this girl here is carrier or not, or what are the chances of her being carrier, you need to know the state of her parents. So we read the line above. Her parents also do not have features of cystic fibrosis. Okay, so once you have practiced enough questions from genetics, at this point you should be able to tell what is the meaning of this line here. Since parents are mentioned, they're referring to the both parents. since do not have features. They didn't say that they're healthy, they said do not have features, which means they are not affected, but they are carriers. Both of them are carriers. In what? In an autosomal recessive condition, this girl has both parents being carriers. Okay, this is the meaning of this line. But since some beginners or even at later stage some people still find it difficult, in that case you just read the stem from the very beginning. So if we start reading the question from the very beginning, you will see Zoe's parents attended the genetic clinic with concern. Their 3-year-old symptomatic boy, okay, a 3-year-old. So these parents that we were talking about at the last of the question, they already have a 3-year-old symptomatic boy who has recently been diagnosed. So they have a diagnosed kid with cystic fibrosis. Okay, so now you're sure that these parents has to be what? They have to be carriers. Why not a single parent being carrier? This question might rise, like maybe one were the carrier, like, but since they said that parents, okay, they wouldn't mention parents. If they were trying to tell you that only one parent is the carrier and another is healthy, they would write her mother do not have feature of cystic fibrosis, or her father doesn't have the features of cystic fibrosis. They wouldn't write parents. By parents they're referring to both of the parents being carriers. Okay, so now you have mm, uh, you are almost sure that the parents are carriers. Not almost, you are sure that the parents are carriers. Okay, we continue reading the question. Zoe, who is 14-year-old girl, has no features of cystic fibrosis. Now this line here changes the whole fate of this question. You will see how. Okay, this next line irrelevant, not needed. Okay, so the clues we first got were both parents are carrier. In what? In an autosomal recessive condition. So we do the math. In an autosomal recessive condition, both the mother and both the father are carriers. So this is the outcome they will have. 1 out of 4 being affected, 1 out of 4 being one being carrier, another being carrier. So 2 out of 4 being carrier and one being healthy. So if we write it down in percentage, if both are carrier in autosomal recessive condition, there is a 50% chance of being carrier, like these two, and 25% being affected, and 25% being healthy. What was the question about? What are the chances of Zoe being carrier in an autosomal recessive condition, the cystic fibrosis? So this should have been 50%, right? Most of the people will mark 2 out of 4, okay? But this is wrong. Remember, I said this line here is very important. This line alone changed the whole face of the question. A 14-year-old girl, okay, she is already 14, having a symptomatic brother who has already diagnosed. If you read the theories related to cystic fibrosis in Plapke's or any other material, you will know that cystic fibrosis is an autosomal recessive disorder which is diagnosed at a very early age, like this sort of age, 3-year, 4-year, 2-year. But since she is already 14 years of age, her time or her risk zone of being affected or having the cystic fibrosis is gone, which means for Zoe this portion is gone. This outcome is not valid for Zoe. So what are the outcomes available for Zoe? 1, 2 and 3. 50% being carrier and 25% being healthy. So her outcome will be measured in 3 possible routes, and the answer was of being carrier was 50%, or 2 outcome, right? Two possibilities of her being carrier. So the result is 50% of 3 outcome, which means 2 out of 3, or 2 is to 3? That is your answer. Since she is already 14 years old with no features of cystic fibrosis, it is safely and most 100% said can be said that she will no longer have cystic fibrosis. But it is not certain that she will not be a carrier. She can be a carrier or she can be healthy. So that is why for her one of the fourth outcome is rejected. What remains are these three outcomes, and the chances of being carrier are 50%. 50% of three outcome means half, or 2 out of 3%. So this is 2 is to 3, and that is why this is your answer. Okay, that is all for today. Hope you were able to learn and know some tricks solving genetics. Thank you for bearing with me for so long. Happy study and good day.